we've been doing research into atrial fibrillation for a while now. So atrial fibrillation is a common abnormal heart rhythm that affects people mainly in their older ages, over 65. And as part of this project, we were interviewing people about what they thought we should do to find atrial fibrillation. So atrial fibrillation increases the risk of having a stroke or heart failure, and people who have a stroke as a result of atrial fibrillation are much sicker, much more likely to have a disabling stroke, much more likely to die. So we want to find atrial fibrillation before it causes those problems. And one of our people that we interviewed was a cardiologist who had commented that he thought that screening in dental settings would be a really good place. You're often waiting while you're having a treatment, and perhaps we could look at that. So that was the sort of initial genesis of the idea. And then we explored it more and really wanted to see the feasibility of this and the link between dental health and atrial fibrillation. So we started looking for partners, and we're lucky enough to team up with the staff at Newcastle Dental Hospital and to plan and deliver the study there. What we're doing is we're asking people to hold a single lead ECG for a period of only 30 seconds. It's a very small device, and we record their heart rate to see if they're in atrial fibrillation or in a normal rhythm, and then if we do find atrial fibrillation, we follow up in that way. We know there's a bidirectional relationship between dental health and the health of the heart. And in the case of atrial fibrillation, there have been some studies recently that have indicated that if you have periodontal disease, you're more likely to have atrial fibrillation, and that we know that people who have periodontal disease are also more likely to have strokes, and that the mediator might be AF. So that was part of the rationale for doing this. We're not going to be able to explore that in enough depth with a sample of only 1,000. What we're really trying to find out is, could we do this if we scaled it up? So I think the real unique point about this is the very applied nature of the work that we do here in the Centre for Cardiovascular Health, and that we're able to think about how we implement things into clinical practice, make changes to policy, make changes in our environment that might potentially improve heart health for people in Scotland, and of course those lessons can be shared globally.